I'm Thomas Baldrick here at ATS 2015 in Denver. With me is Sue Sherman. She is the Executive Director of the LAM Foundation, which is a whole lot easier than saying lymphangioliomyomatosis.
Well said.
Thank you. So let's talk about not only the difficulty saying that disease, but the difficulty that you have in trying to get out the word and develop research.
So, yes, that's part of the goal of the LAM Foundation. We are a patient advocacy group based in Cincinnati, Ohio, and our mission is to find safe and effective treatments for lymphangioliomyomatosis, or LAM, and ultimately to find a cure. There are 14 known cases of LAM in the United States, and 1,400, excuse me, and they are predominantly women. It's almost a 100% gender-specific disease. And so you can imagine that if there's only 1 per million people with this disease, and it's frequently misdiagnosed as asthma or emphysema or allergies, that it's difficult for people to know what it is, and then difficult for us to fundraise for it.
And it is a devastating disease, not only in what it does and the risk involved, but also that it hits a woman mainly during childbearing years.
Absolutely.
Can you talk about those things, how they come together?
Yes. So LAM affects women in the prime of their lives. You have young women who are busy with careers, with young families. They are experiencing what we all do in our 20s and 30s, which is fatigue, trying to keep up with absolutely everything that's going on. And all of a sudden, she's not feeling well, can't quite keep up, and she may go to the doctor, and that's just what she'll get. Well, you're tired, you may have allergies, you may be reacting to something. And when the diagnosis does come through a high-resolution CT scan, the prognosis is not great. So it can lead to lung transplant for some women. For others, they respond well to a treatment that we have. But it takes your breath away. It's very difficult to live with.
So with no cure, limited options, what can we do to help?
Well, the most exciting things going on with LAM and the LAM Foundation is the funding of research. So our patients and families conduct fundraisers, walks, runs, 5Ks all across the country, and then they give that money to the foundation, and we invest between $350,000 and $500,000 a year in basic and clinical research. And we're on the cusp of some breakthroughs that could really be game changers for treating this disease. So our current medication suppresses the progression of the disease. So if I've lost 40% of my lung capacity as a woman with LAM, if I don't get on the medication, it will continue to decline. If I do go on our medication, it stabilizes, but it doesn't kill the disease. So we're hoping to find a second or combination therapy that may kill the disease while it's being suppressed, and that would change everything.
Where can people get more information or perhaps donate?
They can donate at thelamfoundation.org. There's a Donate Now button on that site, and we're based in Cincinnati, Ohio, but the website is definitely the best way to reach us.
Very good. Sue Sherman, thanks for joining us. Good luck to you.
Thank you for this opportunity.
Okay.